We all know that mosquitoes can carry nasty diseases to humans, but did you know that they also carry a life-threatening disease to dogs? Well, they do. Mosquitoes can carry and transfer heartworm disease, which claims the lives of thousands of dogs every year. Here in Texas, we are one of the worst places for this disease. There is an estimated 100 or more cases of heartworms per clinic. Most small towns have 5 or 6 clinics. Just imagine how many clinics are in Houston. We are talking about thousands of cases of heartworms here in our backyard. So here's a little information about heartworms, so hopefully we can prevent the spread of heartworms to our home pets and possibly reduce the spreading among strays. So here's a fun fact. According to the Humane Society of the United States, 62% of Americans have a pet. Of the 62%, 70% have at least one dog, and 46% have at least one cat. So, heartworms are a very common illness among dogs, but they can affect cats as well. 45% of dogs will still have some heartworms in their lifetime. Cats are less likely with a 25% chance. On the bright side, heartworms are preventable. So what is a heartworm? Heartworms are a parasite worm that live in the heart and pulmonary arteries of the affected pet. They can live 5 to 7 years inside of the pet, and it is not uncommon for there to be 30 or more worms in a single dog. These worms are transferred by mosquitoes. First, a mosquito bites an infected animal, ingesting the heartworm larva. While in the mosquito, the larva will develop into what is known as an infective stage. At this point, when a mosquito bites your pet, it will transfer the infective larva. Without prevention, this larva will develop into an adult heartworm, which will enter the pet's bloodstream and eventually make it to the heart. Heartworms do not cause any symptoms until the later stages. A veterinarian can detect the earlier stages of heartworm disease through blood tests. Blood tests look for a substance called antigen or microfilary. These tests will show if a pet has been infected for 7 or more months. Any pet infected less than that amount of time will not show infected on a test. There is currently no earlier detection available. If a pet is known to be infected, the severity of the disease can be decided using x-rays and or an ultrasound. Here's an example of heartworms in a dog. If the heartworm gets to the later stages, your pet will start to show some symptoms. Soft, dry coughing, shortness of breath, loss of stamina, nervousness, and weakness. Some serious symptoms include weight loss, poor overall condition, anemia, congestive heart failure, swelling in the legs and abdomen, and death. 95% of dogs will be successfully treated for heartworms. So treatment for heartworms is an injectable drug which is given several times into the muscle of the back of the dog, spread out over 30-day periods. And it all depends on the severity of the disease. Antibiotics may be given on the side as well to help prevent infections. The pet also must be kept completely quiet while going through treatment. An active or energetic dog bouncing around could cause a heartworm to lodge itself somewhere it's not supposed to be and cause death. After adult heartworms have been treated, the larva will need to be treated. There are several different medications that can be used for this, and it's up to your veterinarian which one is best for your pet. On the bright side, after this treatment, your pet should be able to begin heartworm prevention. Although the heart and lungs may continue to be affected even after treatment, your veterinarian would decide treatment based on the severity of their issues. There are several different types of heartworm prevention to keep your pet safe from this horrible disease. There are oral medications given monthly, such as Trifexis, Sentinel, Comfortis, HeartGuard. There are also topicals, such as Revolution, and 6-month injectables, such as ProHeart. As long as this is given in a timely manner, these are very effective. These medications interrupt heartworm development before the larva can develop into an adult. A single missed dose can be enough to allow your pet to be infected. So, in conclusion, Heartworms are a very serious disease that many pet owners are not fully aware of. Hopefully we can save lives by educating pet owners of the dangers as well as treatment if their pet is already infected.